Hello, everyone, and welcome to Future Proofing Revenue Cycle Amid Change. I am Neo Cairo, and I'm with Nextech, and I'm here with my good friend, Mr. Tim Warner. Tim, why don't you tell us a little bit about yourself?
Yeah, hi, I'm Tim Warner. I'm the Senior Vice President of Channel Development with Assembly Health, and we're excited to be partnered with Nextech to be their exclusive RCM service provider. So we help clients maximize revenue to their business.
Well, that's awesome. One thing that we want to do is have a conversation of we just finished 2024 and a flood of information has come of what's going on in healthcare. We heard from Becker's that the year, as far as gains, was very flat. However, there was definitely a 6% increase in cost of our supplies. And it seems like we're going in a backward spiral as far as volumes, access to care, and denials are up 65% from where they were prior to the pandemic.
It's terrible.
So there's a lot of change. How can we provide some insights to our physicians of how to make it in this reimbursement game? What are some thoughts that you may have regarding some ideas about what's happening in reimbursement and what they can do to
Yeah.
make it through?
Yeah, every day it becomes more complex, more difficult to get reimbursement. That's just the game that the payers play. Is that it's a game of hide the cheese. So they are denying claims, making prior authorizations more difficult, putting more hurdles into place. So as there's rising costs, there needs to be, doctors, physicians, practices need to maximize the reimbursement to be able to offset that. And so you really need to have experts on your side to be able to help you to do that. Payers employ a lot of people and use a lot of technology, including AI, to make it more difficult to get reimbursement. And therefore, practices need to have some expertise, some help on their side to try to level the playing field. And that's what, through Nextech RCM services, we provide is leveling that field in that dynamic.
So one of the things that you mentioned was payers and AI.
Yes.
Tell me a little bit more about that.
Yeah, so payers are spending a lot of money on AI right now. I think the number that I heard recently was $700 million has been invested in AI to help figure out, in my opinion, how to deny claims, how to reduce reimbursement, et cetera. And the average practice out there is unable to invest that kind of money to offset or compete against what the payers are doing. So you need to find a partner that has the expertise, that is able to make the investment, that is able to help level the playing field. The term that I like to use is you need a SEAL Team 6 to help you out. You can't come to this battle kind of as the Revolutionary War or Revolutionary Army that's marching into a battlefield. You have to be more strategic about how you attack these things.
So when you talk about technology and AI, I find that a lot of people get confused with AI. AI is not bots. It is a beginning of bots. That's the automation piece, eliminating tasks. But AI goes a lot further into machine learning. It also goes into decision making. And now they have agents. And the agents are actually facilitating the work so the human can make their decisions and they have clear defined paths. That 700 million that you've mentioned that the payer spent, what's the big differentiator when we look at how AI works and how a human works?
Yeah, so human folks in the office, billers, AR folks, they're working an 8-hour day, 5 days a week. They take weekends off. They maybe get a couple weeks of vacation. Heaven forbid you get sick. AI, that works 7/24, 365. So there's no days off. There's no sick days. So it's again, an uneven playing field that you have on the payer side that is, scrubbing claims, looking for denials, looking for ways to reduce reimbursement. And so you have to try to level that playing field. And if you don't have the technology, you need a partner, or you need to find the technology that can help you in that area.
And reality is, if you are a small practice, you have to keep your mind on human force is not enough.
Yes, that is correct. Yeah, so having a biller that's working 8 hours a day just isn't enough to keep up with what's happening on the payer side.
Tim, what are your thoughts on policy? Policies have, is looming a great deal of policies and changes that are going to come to healthcare. What do you think that's going to impact our providers? How?
Yeah, so anytime there is change that leads to disruption, and even if the change in the rules is seen as a good thing, it's still a change, and you have to adapt to that change, and you have to be able to you know get the claim submitted right, get the reimbursement right. So anytime there is change that leads to disruption, and you need to be on top of that, you need to know what the change is, you need to know how to adapt to that change. And you need to be able to play by the rules that are in place at the time.
Yeah, one of the things that I always think about when you have the changes in policy is the fact that you need to update your systems. You need to be able to make the necessary changes so that you can meet that new policy, but also you have to train your staff.
Yes.
And that's a great opportunity to talk about resources.
Yes.
What is the climate of resources for a winning revenue cycle?
Yeah, so it's hard now to find experts in the revenue cycle field. Folks that have been in it for a long time are aging out, they're moving on to other things. Folks that are coming into the labor force lack the expertise. It's more difficult to get trained and be up on the latest things. There used to be a lot more certifications than there are now. So it's just very difficult. The other thing that we find is, quite often somebody that may work in a billing office, may leave because Amazon's opened up a warehouse, down the road that's able to pay more money. So, that becomes difficult. So you need to have expertise. But not only expertise today, you have to kind of future-proof that. Every day, you have to continue to level up your skills. So you have to have ongoing training. Somebody that was great at RCM 5 or 10 years ago, there's been so much change in the space and the dynamic that you have to keep up with that. So you have to keep evolving on a daily, weekly, yearly basis to keep up.
Yeah, long are gone the days of a biller coming out of high school with no training, just giving them a 2-day training course on billing and being efficient. We're in a situation that billing requires knowledge of policy, knowledge of contracts, and also making sure that you understand the coding rules. So make sure that you spend the time to upskill your staff. That is a requirement for your success.
Yeah, that's one thing. Understanding, you mentioned contracts, payer contracts that we see a lot, is that practices, they can't even lay their hands on their payer contracts. If they can find them, they're very old and their system has not been updated to stay up to speed with where things are at. Or maybe they set their system up according to a payer contract 10 years ago. They've renegotiated it and their system has not been updated to support that payer contract. And that can lead to a lot of problems with reimbursement and not being reimbursed appropriately.
That's a very, very good point. The other area that I'm seeing is cost. Drug costs are going up. They've gone up 8% from the prior year over year. And now with some of the new policies that are coming into light, like the tariffs, there's an expectation of a 10 to 15% increase in drug costs, according to Black Book. So how does that impact an office that maybe has injectables or procedures that require some devices?
Yes. So it's very important to keep the fee schedules or the prices in the system updated. So reviewing on a quarterly basis the average suggested price, in the system, making sure that that's updated. We quite often see that that's outdated, so people are not billing out at what they could or should bill out. Also making sure the right units of drugs are used. We often see that those are not done properly. So physicians or practices are leaving a lot of money on the table because they're billing out based on old fee schedules, antiquated data, and they're shorting themselves.
Yeah, and this is not a time that we can really take that risk. You know, injectables are going to go up in price. We know this. So understand the days of just billing the injectables and bill it and forget it. Well, that's not going to work. You have to look at your denials. You have to appeal them. You have to make sure you have the right NDC number, the right pricing, because what's going to happen is the offset of the cost that you had to buy that injectable. You may not get it in your reimbursement. So now is the time to really look at how we bill our injectables and how we do the follow-up to get our money for the services we're providing.
I think that's an important point that many practices kind of lose sight of. That they may think about denials, rejections on the procedure side of things, but on the injectable side, they just think of, hey, send a claim out, get a payment back, and they're not really doing that denials management, that AR follow-up that's very important to get reimbursed. And so, you know, they lose sight of that, and they end up not being reimbursed the money that they're owed.
Absolutely. So, you know, when we look at all that, we think of revenue leakage. How do you secure that you are not in a situation that you're leaving money on the table consistently?
Yeah, I think revenue leakage is something that we see happens in a lot of practices. It requires a high level of attention to detail to make sure that everything is operating smoothly. It starts with system setup. So whatever system that you're using, making sure that your fee schedules are loaded appropriately, that they correspond to the payer contracts that you have, that you're using the right kind of modifiers when you bill, that you have the right clinical documentation. If there's a laterality involved in a claim that you're doing, that you're documenting that appropriate. There's so many small things, some big things, but also some small things that can add up to be real money. And it's a constant loop or cycle that you have to go through. It's not something that you can think about once on system setup and forget about it for years. You have to every day be thinking about, how are we improving our process? How are we improving our setup? You know, is our clinical documentation correct? Are we getting the correct information, you know, when a patient comes in? Because we do see that claims, the reimbursement of claims, even if it's accepted and paid, can be paid at a lower rate if you don't have the right documentation. You used a wrong modifier, or the documentation wasn't up to snuff. So it's very important that all of those things work together to ensure that you are maximizing your reimbursement, because providers should be paid for what they do, not less than what they do.
What are some things that your providers are keeping an eye on, you know, that is laser focused in the practices that you're working on? What's the noise that you're hearing inside the industry right now?
Yeah, I think just there are several things. You know, providers want to provide care. They want to care for their patients, and they don't want to have to deal with all the other distractions around reimbursement. So, you know, it's becoming more complex. There's more rules that are in place, and those things that get in the way of a provider actually providing care, you know, it is frustrating for providers. And so, you know, looking for ways to streamline that, partnering with people that can help providers just focus on giving quality care to patients, and having partner or resources that help guide providers through that process, that can help them navigate, you know, this difficult environment that we're in. And it's only going to get more difficult and more complex every day. So that's very important.
So are you seeing a trend to providers maybe joining forces, whether it's small groups becoming big groups, or VC firms maybe, or PE firms
Yes.
buying groups? Can you
Yes.
let's talk about that.
Yeah, so we do see that there are a lot of providers, small practices that are deciding that it's better to join forces because they have more negotiating power, more synergies in the market. We also see groups that are, PE firms are very active in the provider space. So they are acquiring and building lots of platform companies out there. So we do see a lot of that. So that kind of each one of those scenarios is unique. So having somebody help you navigate whether you're going from a single provider practice to joining forces with somebody else, a 5 or 10 provider practice, or you're that 10 provider practice that's being acquired by private equity. Helping folks navigate that is important. And then from the reimbursement side, each one of those groups has its own set of challenges, their own way of wanting to look at information. Small practice provider, may have one set of KPIs, key performance indicators that they want to look at. If you're owned by private equity, that's going to be a completely different set of metrics. All of them are important. It's just how people view their business.
Absolutely. And also how they operate.
Yes.
So when you are helping providers that are growing and make
Yes.
the decision to join forces, do you see a shift in how do we operate? This is the way I do it in X. This is
Yes.
the way I do it in Y.
Yes, I think the first step of that is doing a workflow analysis. So understanding what is the workflow in either the practice or multiple practices, and agreeing to what workflow makes sense. So there are best practices out there and adopting those, but also keeping an eye on what may work well in one region, one city, one community may not work somewhere else. So being flexible enough to be able to accommodate for those nuances, yet still trying to adopt a streamlined, efficient process is very important. And then the metrics that you're looking at, to evaluate how you're performing. Those metrics might include things like net collection rate, days in AR over 90, denial rate, clean claim rate. All of those things are important metrics to understand how a practice is performing and how efficient they're being.
One of the things that we are seeing in the industry from looking at data from 2024 is an increase in bad debt. And not only from the insurance side, but also an increase from the patient side. What are some things or tips that you can give providers about the patient experience and making sure that the patients are able to pay their statements timely, and they can reduce the amount of bad debt from the patient side?
Yeah. I think it starts in the very beginning with being able to articulate to a patient if there is going to be some out-of-pocket money, what that looks like. At the time of scheduling the appointment, you realize that there is an X dollar copay, or you have some deductible that you still have to pay. So helping the client understand that, collecting any money that you can from the patient at the time of service. So when they first present at the front desk, collecting money, giving them options through paying through text or through a portal is very important. And then on the back end, once a claim is submitted, adjudicated to an insurance payer, and there's a patient responsibility, making sure that that bill or statement gets out in a timely fashion. This data suggests that the sooner a patient receives a statement or a bill, the more likely they are to pay it. So, if long period of time is going by, from the time you send the statement out, it's more difficult to collect. And then having a good patient services team to take phone calls. So folks that take the phone call that can answer questions, why do I have this copay? Why do I have this deductible? I thought insurance was going to pay. Being able to explain to the patient why they do have a patient responsibility, and being able to facilitate collection of that balance on the phone are all kind of tools that you can use to ensure that you're getting paid and getting paid in a timely fashion.
So if you were to open a new practice, what are the things that you would be concerned to make sure that you set up properly?
Yeah, it starts, if I'm thinking about reimbursement, in the beginning with laying a good foundation, picking a good software vendor to partner with, having the right build of the system, both on the clinical side and on the financial side. Making sure that I've set up fee schedules appropriately, software is configured right, enrollment with the clearinghouses, EDI is set up right, that I've gone through an ACH optimization. We see a lot of clients that still receive paper checks, and you get a paper check that delays the time that the money hits your bank account. It also increases the opportunity for error of something going wrong in that. So you have to build a proper foundation first, before you put the house up. I think also partnering with experts in the space, not trying to go it alone, especially in a smaller practice where, if you're a single 5-10 provider practice, assuming that you have, all the knowledge to be able to compete with the payers. And I use that term intentionally, to compete with the payers. You need experts to help you do that. So picking the right partner, having the right people coach you through that process is extremely important.
Excellent. I think the only other area that's an area of focus for all the providers is volume. How do you stand out from the rest? How do you make it so your patients know that you are their trusted go-to, not only for the clinical care, but for the experience?
Yeah.
What are some tips that you can provide?
Yeah, you want the provider can control, their interaction with the patient when they're in the exam room. But once you get past that and you get into things like, we've already talked about patient statements, ensuring that they get a timely statement, that the statement is easy to understand. If a phone call is made about the statement, you've got a polite person on the other side that's willing to explain, because all of that impacts patient experience. And so a doctor or provider could be giving great care in the office, but, one phone call about a patient bill and they talk to a cranky agent will ruin the whole experience. And now that patient is like, I don't like Dr. Jones anymore because this person in the billing office, didn't help me out, wasn't kind to me, wasn't compassionate to me. And so that can ruin the whole thing. And now Dr. Jones has lost a patient, and, that patient is telling 10 other friends at Bridge Night, that they had a bad experience. So, you don't want that to happen. You want everybody that is in your circle, everybody that is working with your patients, to provide a high level of service, to show care, compassion.
That is such a real story. I think about just recently, my husband, his cardiologist, we did not get any statements for 6 months. And however, we knew the claim had already been paid by the insurance because we had gotten the EOB at home.
Right.
And we were waiting for these statements. And when he called about, well, where's my, statement so I can pay on this, he got crickets from this particular provider. And he literally said, you know what? If you don't take care of your business side, then you really must have other issues that you're not taking care of. And he did change doctors.
Yeah.
It happened in my home.
Yeah.
He changed doctors, and that was his decision.
Yeah.
And it was because of revenue cycle that person walked away. My husband walked away from his doctor. And, it may sound silly to somebody, but it's all an experience.
It is.
It is all an experience.
It is. I've been through similar experience where, there's an awesome provider, but that awesome provider is surrounded by some infrastructure, people, resources that are less awesome. And it makes it really challenging. It's like, do I want to continue to see that person if all these other folks around are frustrating the process, making it difficult, making it, healthcare sometimes, you're going into a situation where you may be just physically uncomfortable. You may also be scared because you don't know what's going on, and you need to have folks that surround that are showing care and compassion, to make it either more pleasant or at least the least stressful that situation can be.
The calm.
Yeah.
Bring the calm in.
Bring the calm. Yep.
Absolutely. How do they keep their reimbursement strong in the future so that they can grow and expand?
Yeah. Um, Yeah, so just some additional thoughts. Again, you need to have the expertise, the wisdom to help compete against these very, very large organizations, whose job it is to manage reimbursement. They're trying to reduce what they're paying out so that they can either spread money across more areas or return money to their shareholders. And I know that I've spent 30 years of my life in the healthcare space, and it can still be confusing to me when I get an EOB or a statement, and for somebody like me to sometimes be confused, the average patient out there is really got to be challenged. And this is about providing care to people, about making sure that the patient experience is as good as it can be. And one of the things that I kind of live by is without margin there is no mission, or said the other way, there is no mission without margin. And so it's important that we are maximizing reimbursement for providers so that they can provide that care to their patients, because ultimately that's what the most important thing is. Providers want to provide world-class care, and we're a part of that equation, to give them the resources to do that.
Sounds wonderful. Well, thank you all for listening in as we talked about how to future proof your revenue cycle. And we are always open for questions, and we will be responding to questions.